Okay, guys. So now we'll go on to right-sided heart failure. So it doesn't make as much sense, but right means body. Um, so the medical history, the pressure builds into the venous system. Left-sided ventricular failure can lead to right-sided failure. You can also have a right ventricular MI. You can have right-sided failure without left-sided involvement. And when you have that, it's usually from pulmonary problems such as COPD. In the cardiovascular system, you will see peripheral edema. Um, you will see weight gain. You might, before they have a lot of edema that is visible. They may talk about how the rings are getting tighter, their shoes are getting tighter. Remember, we look at daily weights. Most of the time, a weight gain of 2 pounds is significant, especially in a day. But if the patient is real, like there's a fine balance for them, the physician may decrease that amount. And you also may want to, if you don't see a lot of edema in the extremities, or in the lower extremities especially, and the patient's been laying down or sitting up in their recliner, flip them over and look for sacral edema, because anytime you've got those legs elevated, you're going to have decreased edema to those extremities, and people may think, "Oh, good, my edema's gotten better." Or my swelling's better. It really isn't. It's just moved into that sacral area. Again, it's a debilitating disorder, so they can have feelings of depression. GI, they can have nausea and anorexia. Always assess for liver engorgement. These patients can also have ascites. You may hear women go, "I wasn't this big when I was pregnant," or you may see that they just have a real rotund belly. And remember, when it's ascites, it's more tympanic sounding. It's not obese. It's not soft and squishy. It's a firmer feeling. And a lot of times, physicians will have you measure their abdominal girth to see if that is how bad that ascites is getting. So here we have our little lady with her right-sided failure. She's fatigued. She has increased peripheral vascular pressures. She may have ascites. She's got enlarged liver and spleen. This is the patient who will have the distended jugular veins. You'll see them more pronounced. They will complain of anorexia. They'll complain of their hands and fingers swelling. A lot of times, that's one of the first signs when people will start talking about how they can't get their rings off, or their dress shoes were tight. They'll talk about, I couldn't even get my Sunday shoes on. Um, because they may wear more comfortable shoes during the week, and then when they go to religious services, whether it be Saturday or Sunday or Wednesday night or Tuesday, whatever there is, and they put on more dressier shoes, they may find that they're more tight on their feet. So those are all good questions to ask someone who we're concerned with right-sided failure. So now we're going to go on to talking about care of the patient with heart failure. So one of the things we need to do is increase their gas exchange. And when you're increasing a patient's gas exchange, we're going to use oxygen if needed. Now remember, oxygen is a medication requiring an order, and you want to use the least amount that you need. You're going to assist with positioning. This patient probably is going to feel better sitting more upright in bed. They may need to put some pillows underneath their legs to help elevate them a little bit. You're going to do frequent lung assessments, because these patients, especially the left-sided heart failure patient, can their lungs can change very quickly. They can go from having just a few crackles in the bases of their lungs to being completely congested and full and unable to breathe adequately on their own, progressing into pulmonary edema. So even with your chronic patient, you want to make sure that you're assessing those lungs frequently. And I would like to add there that even if the provider has said that, or because you work on a unit that focused assessments only need to be done every 4 hours. Or 8 hours. If you know you have a patient who has heart failure, yeah, I'm known to do more frequent focused assessments than I have to, in accordance with the policy. You, as a nurse, you can always choose to assess your patients more frequently than is ordered, because it's non-invasive. You're just listening to their lungs really quickly. Now, I wouldn't do the full-on assessment, but for instance, if I know that the crackles are in their bases and I can only hear them posteriorly, I'll listen there and then I'll work my way up and see if I hear them any further up. I think it's very important to continue to listen to those lungs fairly frequently when you're dealing with a patient with heart failure. Moving on, we're going to want to increase perfusion by improving cardiac output. This is generally done with medications. We want to decrease the afterload. They use nitrates, which decreases systemic vascular resistance and decrease peripheral vascular resistance. They use ACE inhibitors and ARBs that will decrease that peripheral vascular resistance, decrease cardiac workload, and it can also decrease the ventricular remodeling. Continuing on with the care of the heart failure patient, you're going to want to increase perfusion, which is improving that cardiac output, reducing the preload. Heart failure with congestion and volume overload, you're going to look at dietary changes. They're going to want to not only be on a low salt diet, but they also want to avoid the salt substitutes because they are so high in potassium that it can increase their potassium levels into dangerous levels. They'll be on diuretics, whether it be a loop or a thiazide. We're going to need to monitor their potassium. We're going to need to monitor their weight, and those weights need to be daily. Daily weights are best done first thing in the morning with, as one of my a retired old cardiologist used to say, with nothing but you and what your mama brought you in with, meaning naked on a scale after you have already voided, is the best way to do a daily weight. So first thing in the morning, go tinkle, take your clothes off, and get on the scale. If they're like, well, I don't feel comfortable without my clothes on, say, fine, then I want you to wear the exact same, dressing gown or the exact same type of pajamas every time you get on that scale. But it is important to make sure that they void prior to that daily weight, because you don't want to misconstrue a weight because they need to void. Nitrates, you're going to want to, for venous dilatation, it reduces venous return on the preload. So increasing the